Our core mission at TGH, our shared purpose at TGH is to heal, is to teach, is to innovate. We believe very simply that it's a right to access world-class healthcare. It shouldn't be a privilege. And what we're really creating through our specialty pharmacy is a strong, resilient, and highly reliable program that's there to benefit our patients.
Most of our patients are able to get the drugs for free or at a very reduced cost because of the work that the specialty pharmacy does. They are able to educate the patient on the risk and benefit of the drugs, side effect profiles, what they should be monitoring, and really provide an additional support in that space outside of what the education that the physician provides, which tends to be in a time where patients can be a little bit overwhelmed and getting a lot of information. And so reiterating that information really allows them to process better.
Today, we manage over 15 disease states, enrolling close to 3,000 new patients every quarter, and currently have over 10,000 patients on service. We're projected to double those patients on service to 20,000 patients in less than a year. We have incorporated the liaison into our care model, which has been a critical component, and they really are serving an extension to patients and providers as a resource.
My role as a specialty pharmacy liaison helps overcome the gaps in care with patients. I come in with providing them the world-class care, which is individualized, specialized support to get them through their diagnosis.
The services include 24-hour access to clinical pharmacists. We support prior authorizations as well as financial assistance and sourcing copay cards, foundations, grants, and free drugs through the manufacturer. So the communication and the coordination of care is improved as a result of being integrated within the health system.
Having a dedicated liaison and a team that manages your medication, you get to know the people that are managing your medication, and you develop relationships with them. And from my standpoint, it allows me to hold space for you when you're having a rough day, or provide extra support in any way that I can. That goes along with being able to reach out to the clinic staff directly, whereas with an outside pharmacy, there's a lot of phone calls and a lot of wait times. For me, it's a simple message to the provider, and we get access to the information that we need for our patients in real time.
We're about building a patient-centered system of care that eliminates fragmentation and eliminates friction. And specialty pharmacy does that. Where I see this going is I see this becoming bigger. I see it becoming more integrated in the work that we do. I think the future is incredibly bright.